During a cardiac arrest, what is the recommended maximum interruption time in chest compressions when switching compressors? A. 20 seconds. B. 15 seconds. C. 10 seconds. D. 5 seconds. Answer: C. Compression interruptions should be less than 10 seconds to maintain coronary perfusion pressure. In pulseless ventricular tachycardia, the first medication after the second defibrillation should be A. Atropine. B. Epinephrine. C. Amiodarone. D. Magnesium sulfate. Answer: B. Epinephrine 1 mg every 3 to 5 minutes is given first, followed by amiodarone if refractory. Which finding differentiates unstable tachycardia requiring immediate cardioversion from stable tachycardia? A. Heart rate above 150 bpm. B. Presence of a wide QRS. C. Systolic blood pressure less than 90 mm of mercury. D. Regular rhythm. Answer: C. Unstable tachycardia is defined by hypotension, chest pain, altered mental status, or shock, regardless of rate. What is the recommended initial energy dose for synchronized cardioversion in unstable atrial fibrillation? A. 50 joules. B. 100 joules. C. 150 joules. D. 200 joules. Answer: B. For atrial fibrillation, synchronized cardioversion is typically started at 100 joules. In post-cardiac arrest care, what oxygen saturation target should be maintained? A. 85 to 90%. B. 90 to 92%. C. 94 to 99%. D. 100% continuously. Answer: C. Oxygenation should be titrated to 94 to 99% to avoid hypoxia and oxygen toxicity. Which is the most reliable indicator of effective chest compressions? A. Chest wall recoil. B. EtCO2 greater than or equal to 10 mm of mercury. C. Rate of 100/120/min. D. Depth of 5 centimeters. Answer: B. End-tidal CO2 greater than or equal to 10 mm of mercury confirms adequate perfusion during compressions. In asystole, which of the following is appropriate? A. Defibrillation. B. High-quality CPR and epinephrine. C. Synchronized cardioversion. D. Amiodarone administration. Answer: B. Asystole is a non-shockable rhythm, requiring CPR and epinephrine. Which medication is contraindicated in wide complex tachycardia of uncertain origin? A. Amiodarone. B. Lidocaine. C. Procainamide. D. Adenosine. Answer: D. Adenosine can worsen or cause deterioration in irregular or polymorphic wide complex tachycardias. During ACLS, which advanced airway is considered equivalent to endotracheal intubation if performed correctly? A. Oropharyngeal airway. B. Nasopharyngeal airway. C. Supraglottic airway. D. Nasal cannula with high flow. Answer: C. Supraglottic devices, LMA, iGel, are acceptable advanced airways when intubation is not feasible. Which action is most critical immediately after ROSC? A. Administer amiodarone. B. Initiate hypothermia protocol. C. Optimize oxygen and ventilation. D. Give another dose of epinephrine. Answer: C. After ROSC, maintaining oxygen and ventilation is the first priority before other interventions. Which rhythm is most likely to respond to defibrillation? A. Asystole. B. Pulseless electrical activity. C. Ventricular fibrillation. D. Sinus bradycardia. Answer, C. VF and pulseless VT are shockable rhythms, unlike asystole or PA. When administering amiodarone during cardiac arrest, the first 4 doses: A. 150 mg, B. 300 mg, C. 75 mg, D. 100 mg. Answer, B. The first dose is 300 mg for push, followed by 150 mg if needed. Which monitoring tool is most accurate for detecting return of spontaneous circulation during CPR? A. Palpation of carotid pulse. B. Arterial line waveform. C. Oxygen saturation. D. EtCO2 waveform. Answer, D. A sudden rise in EtCO2 suggests ROSC before a palpable pulse is confirmed. In adult bradycardia with hypotension, which is the first drug of choice? A. Amiodarone. B. Atropine. C. Dopamine. D. Epinephrine. Answer, B. Atropine 1 mg for every 3 to 5 minutes is the first-line drug for symptomatic bradycardia. Which intervention is recommended for refractory VF after multiple shocks, CPR, and epinephrine? A. Atropine. B. Amiodarone. C. Adenosine. D. Calcium chloride. Answer, B. Amiodarone is the antiarrhythmic of choice for refractory VF or pulseless VT. For an adult patient with pulseless VT, what is the initial defibrillation energy when using a biphasic defibrillator? A. 50 joules. B. 120 to 200 joules. C. 300 joules. D. 360 joules. Answer, B. Biphasic defibrillators are effective at 120 to 200 joules, per manufacturer guidance. Which condition must be corrected during resuscitation to reverse PA? A. Hypovolemia. B. Hyperglycemia. C. Hypertension. D. Hyperlipidemia. Answer, A. Hypovolemia is one of the H's and T's, common reversible causes of PA. Which is the most appropriate method for verifying endotracheal tube placement during CPR? A. Bilateral chest rise. B. Auscultation. C. Continuous waveform capnography. D. Fogging in tube. Answer, C. Capnography is the gold standard for confirming tube placement. If atropine is ineffective in severe symptomatic bradycardia, the next recommended intervention is A. Transcutaneous pacing. B. Defibrillation. C. Amiodarone. D. Oxygen alone. Answer, A. Transcutaneous pacing is the next step if atropine does not improve the rhythm. During a resuscitation, EtCO2 levels fall below 10 mm of mercury despite good effort. What does this indicate? A. ROSC is likely. B. CPR quality is poor. C. Oxygenation is excessive. D. The patient is hyperventilating. Answer, B. EtCO2 less than 10 mm of mercury usually means chest compressions are not generating enough circulation. Which of the following is a shockable rhythm? A. Pulseless electrical activity. B. Ventricular fibrillation. C. Asystole. D. Sinus tachycardia. Answer, B. VF and pulseless VT are shockable, PA and asystole are not. The maximum single dose of atropine for bradycardia should not exceed A. 1 mg. B. 2 mg. C. 3 mg. D. 5 mg. Answer, C. The total maximum dose is 3 mg in bradycardia management. Which ACLS drug is contraindicated in torsades de pointes? A. Amiodarone. B. Magnesium sulfate. C. Lidocaine. D. Epinephrine. Answer A. Amiodarone can worsen torsades, magnesium sulfate is preferred. Which reversible cause of cardiac arrest is best treated with needle decompression? A. Hypoxia. B. Hypothermia. C. Tension pneumothorax. D. Hyperkalemia. Answer C. Tension pneumothorax is treated with needle decompression followed by chest tube. During cardiac arrest, how often should rhythm checks be performed? A. Every 30 seconds. B. Every 1 minute. C. Every 2 minutes. D. Every 5 minutes. Answer C. Rhythm and pulse checks should occur every 2 minutes during CPR cycles. Which drug is indicated for stable monomorphic VT with a pulse? A. Adenosine. B. Amiodarone. C. Atropine. D. Epinephrine. Answer B. Amiodarone 4 is the treatment for stable monomorphic VT. Which electrolyte abnormality is most associated with pulseless VT or VF? A. Hypocalcemia. B. Hyperkalemia. C. Hyponatremia. D. Hypermagnesemia. Answer B. Severe hyperkalemia predisposes patients to VF or pulseless VT. What is the first-line treatment for unstable supraventricular tachycardia, SVT? A. Adenosine. B. Atropine. C. Synchronized cardioversion. D. Amiodarone. Answer C. If unstable, synchronized cardioversion is preferred over drug therapy. Which waveform capnography reading suggests high-quality CPR? A. EtCO2 greater than 20 mm of mercury. B. EtCO2 less than 5 mm of mercury. C. EtCO2 between 5 to 10 mm of mercury. D. Flat-line capnography. Answer A. EtCO2 greater than 20 mm of mercury reflects effective chest compressions and perfusion. Which intervention is most appropriate in hypothermic cardiac arrest? A. Withhold defibrillation until rewarmed. B. Limit shocks to 1. C. Continue defibrillation and rewarming. D. Avoid epinephrine completely. Answer C. Hypothermic arrests still require defibrillation alongside rewarming strategies. Which drug is not recommended in routine cardiac arrest management? A. Epinephrine. B. Amiodarone. C. Lidocaine. D. Atropine. Answer D. Atropine is no longer recommended for asystole or PA. Which condition is a common cause of pulseless electrical activity? A. Hyperthyroidism. B. Hypovolemia. C. Hypertension. D. COPD. Answer B. Hypovolemia is a reversible cause of PA, one of the H's. Which monitoring value best predicts successful ROSC? A. Heart rate. B. Oxygen saturation. C. EtCO2 above 40 mm of mercury. D. Systolic BP above 60 mm of mercury. Answer C. Sustained EtCO2 greater than 40 mm of mercury often indicates ROSC. What is the immediate treatment for symptomatic bradycardia in a heart transplant patient? A. Atropine. B. Epinephrine. C. Amiodarone. D. Adenosine. Answer B. Atropine is ineffective in transplanted hearts, epinephrine or pacing is required. Which intervention is used for unstable polymorphic VT, torsades? A. Defibrillation. B. Atropine. C. Adenosine. D. Synchronized cardioversion. Answer A. Polymorphic VT is treated as VF and requires immediate defibrillation. Which ACLS medication is also a vasopressor used in septic shock? A. Amiodarone. B. Dopamine. C. Atropine. D. Lidocaine. Answer B. Dopamine is both an ACLS bradycardia drug and a vasopressor in shock. What is the compression to ventilation ratio in adult CPR without an advanced airway? A. 15:2. B. 30:2. C. 5:1. D. Continuous compressions. Answer B. The standard ratio is 30:2 for adults when no advanced airway is in place. Which drug is used specifically to terminate SVT caused by AV nodal reentry? A. Amiodarone. B. Adenosine. C. Atropine. D. Epinephrine. Answer B. Adenosine interrupts AV nodal conduction, terminating AVNRT. What is the primary benefit of therapeutic hypothermia after cardiac arrest? A. Enhances oxygen delivery. B. Prevents arrhythmias. C. Improves neurological outcomes. D. Increases blood pressure. Answer C. Targeted temperature management reduces brain injury and improves survival outcomes. Which of the following is an H or T reversible cause of cardiac arrest? A. Hypoxia. B. Hyperlipidemia. C. Hypertension. D. Hypothyroidism. Answer A. Hypoxia is one of the common reversible causes, H's and T's.